A very good day to everyone. My name is Muhammad Aisham Ibidin and my student identification number is 8407090853070001. Today I will be presenting on the topic Optimizing Ergonomics, Strategies for a Healthier and More Productive Workplace, prepared as part of the requirement for the course NBCP2522, Clinical Practice Occupational and Health Management. In the expansive and ever-evolving disciplines of occupational health, our attention is often drawn towards the dramatic and easily visible hazards, chemical spills that demand immediate containment, heavy machinery capable of inflicting acute harm, or infectious diseases requiring strict protocols. Yet, hidden beneath these obvious threats lies a quieter, more pervasive category of risk. This risk infiltrates nearly every type of workplace environment, from the most chaotic emergency department to the most serene corporate office. My primary intention is to shift your professional lens. Ergonomics must no longer be reduced to the simplistic notion of purchasing a more comfortable chair. Instead, we must recognize it as a critical, clinical, operational, and strategic disciplines. One that harmonizes human physiology with occupational efficiency. It is a science that shapes healthier workers, more sustainable workflows, and ultimately more resilient organizations. To begin this exploration meaningfully, we must construct a precise and unified definition of ergonomics. What truly is ergonomics? At its core, ergonomics is the applied science of design. But on a more philosophical level, it is the art of alignment, the alignments between human capability and environmental demand. As defined by OSHA, its central principle is the idea of fitting the job to the worker, rather than forcing the worker to fit the job. Reflects on that distinction for a moment. When we insist that the human body adapt to an environment or workflow that disregards its anatomical and physiological limits, we create frictions. This friction gradually manifests as fatigue, persistent discomfort, and eventually chronic pathological conditions. Our responsibility and our goal is to systematically remove that friction, replacing strain with synergy. Why is this discussion urgent? Because many ergonomic hazards remain invisible until they evolve into irreversible damage. We are addressing musculoskeletal disorders, MSDs. These conditions are not trivial complaints or ordinary acts. They are cumulative traumas resulting from repeated micro-injuries. Let us break down the primary contributors. Repetitive motions gradually degrade soft tissues, wearing down tendons, ligaments, and joint structures over time. Awkward postures, such as the habitual slouching illustrated in the image, place uneven and abnormal loads on the spine and surrounding musculature. Static positions, including simply sitting or standing still for long periods, limit blood flow and reduce metabolic waste removal, causing muscular ischemia and long-term tension. As emphasized by Tulane University, these ergonomic stresses are the silent saboteurs that slowly erode workforce health. They undermine performance long before visible symptoms emerge. If the clinical and physiological arguments are not sufficiently compelling, then the empirical data should capture your attentions. Observe the figures on the screens. 33%, one-third of all workplace injuries are directly linked to ergonomic factors. This is not a marginal problem. It represents a profound portion of our occupational disease burden. But here lies a powerful counter-narrative. Organizations that invest in comprehensive ergonomic strategies report an average 25% increase in productivity. This demonstrates an essential truth. Health and performance are not competing priorities. They are mutually reinforcing. When you design environments that reduce stress and promote comfort, you inadvertently accelerate efficiency, improve quality, and enhance workforce engagement. So, what does an optimally designed workstation actually look like? To understand this, we must examine the principle of neutral body positioning. The monitor must be positioned at eye level. If the head tilts downwards even slightly, it increases torque on the cervical spine, placing unnecessary strain on the deep neck flexors. The elbows should hang naturally beside the body, forming a 90-degree angle at the joint. This positioning minimizes tensions across the trapezius and reduces upper limb fatigue. The wrists must remain neutral, flat and aligned with the forearm. An unnecessary wrist extension or flexions during typing compresses the carpal tunnel and accelerates nerve irritations. This configuration is not about achieving luxury or comfort for convenience. It is about establishing biomechanical neutrality that supports long-term musculoskeletal health. Yet, ergonomics extends far beyond the physical workstation itself. It encompasses the entire sensory and cognitive environments in which an individual performs their tasks. Lighting plays a crucial role. Inadequate or overly harsh lighting forces the eyes to strain and compels the body to lean forwards, leading to postural compromise. Noise introduces acoustic stress that triggers cortisol release. Even low-level background noise can activate a subtle fight or flight response, which drains cognitive energy and reduces attention span. Temperature impacts physiological comfort. When workers are too cold or too warm, their cognitive functions declines as the body diverts resources to regulate internal homeostasis. Thus, our objective is not merely to design a good desk. It is to curate a workplace ecosystem that supports human physiology instead of challenging it. However, ergonomic equipment is only one side of the equations. The other side, often overlooked, is human behavior. There is a well-known phrase, "The best posture is your next posture," and it is profoundly true. Movement acts as a form of medicine. I strongly advocate implementing the 20-20-20 rules. Every 20 minutes, workers should look 20 feet away for 20 seconds. This brief pause resets ocular muscles, reduces accommodative fatigue, and improves visual endurance. Additionally, micro breaks are essentials. The human body was designed for movement, not static holding patterns, regular micro movements, standing, stretching, shifting weight, reinvigorate the circulations and reduce tissue strain. These habits must be integrated into our professional culture, not treated as optional extras. In clinical environments, we prioritize using the right instrument for surgery, examinations, and interventions. Office settings require similar intentionality. Vertical mice repositions the radius and ulna into a neutral alignment, reducing forearms pronations and easing muscular tensions. Split keyboards encourage a more natural shoulder and chest alignments, preventing the habitual rolling forwards of the upper body. Sit-stand desk facilitates dynamic patterns of posture modifications throughout the day. These tools should not be dismissed as technological accessories. They function as preventative medical devices that safeguard long-term musculoskeletal well-being. So how do we translate ergonomics principles into everyday operations? The answer requires a shift in organizational culture. Purchasing a single ergonomic chair and walking away does not constitute a strategy. Instead, we must build systems, risk assessments, regular proactive identification of ergonomics hazards before injury occurs. Training, structured education that empowers employees to understand their bodies and equipments. Feedback loops, a culture of physiological safety where staff feel comfortable reporting discomfort early, long before it escalates to injury, surgery, or long-term disability. Sustainable ergonomics practice must be embedded into the organizational identity. Now, consider the impact of performance and efficiency. The data shows that conventional office setups operate at roughly 75% efficiency, primarily due to fatigue, distractions, and physical discomfort. In contrast, environments optimized for ergonomics achieve efficiencies approaching 94%. The reason is simple. When the body is no longer a source of distractions, the mind has greater cognitive bandwidth. Comfort enables sharper thinking, sustained focus, and improved overall work quality. In conclusions, I want to leave you with a profound reminder from OSHA. Good ergonomics is a good economics. But from a healthcare perspective, I believe the message extends further. Good ergonomics is not only about organizational efficiency. It is about humanity. It is about recognizing, respecting, and supporting the intrinsic limits and extraordinary potentials of the human body. When we optimize ergonomics, we create not just better workers, but healthier, more empowered individuals. Thank you sincerely for your attentions and engagement. That's all from me. Goodbye and Assalamualaikum.